Hey, it's another Monday Morning with Mike, with Marcia and Nick right here at the Timber Ridge facility in their garden. So I'm here with Nick. He's the administrator here at the Timber Ridge. And Nick, I wanted you to tell us a little bit about all the changes that have been happening here in the last few months.
In the last few months, we've been able to open back up East Wing, which is our sunrise garden, which is what we're sitting outside of right now. We were able to move the residents over from Hillside Meadow, so we kind of closed down Hillside Meadow for a little bit, but we were able to open back up the chapel so that we can have church services back in the chapel, and the residents really seem to enjoy that. Along with that, we've also been able to increase our overall residents census in the building, which means that we're able to help the residents of Portage County stay close to home, stay where their family is, and still get the care that they need. We've been able to up our overall census by about 10 to 12 patients, which has really helped us support this county.
And that's really the important thing is, helping all of the residents of Portage County through this facility.
Correct. I mean, having that option so they don't have to travel to Wausau, they don't have to travel to Wapaka, so they can stay local, families can come and see them. It's more like home, their friends can show up. It's just nicer for them to be a part of the community.
This is part of the community. It's not out in the middle of nowhere. It's right here in town.
Correct, and we like to try to keep as many things with that local too. So we like to try to help out the smaller company businesses and whatnot. We try to reach out to some of the ones downtown on the square and those kind of places and just be a part of them and try to partner with them and try to provide things for the county and the town as well.
So I'm here with Marcia, and Marcia's been with the facility for over 10 years. And she's going to tell us a little bit about the changes that have occurred here over the last few months.
Thanks, Mike. It's a pleasure. Actually, I've been here 10 plus years as administrator and now as the rebranding person. And just in the past 3 months, we have made an exceptional change for the great. And we always provided excellent care. What we're able to do now, Mike, is we've taken the facility to state-of-the-art care. New electronic medical records. We've opened our doors to a plethora of different types of resident care situations, but we've kept that heart. Our heart and home is still here. What we've added is not only maintaining the same team, we've given them the tools to really excel. So it's been very exciting.
How have the staff responded to the changes?
Amazing, amazing. We retain just about 100% of our team. Ensign has been extremely good to the employees. In fact, they've enhanced the quality of the compensation for each team member. But what they've brought to the table that we were unable to do is a devotion to human resources. We have a full-time human resource person that solely looks at the needs of our team members, because when you have happy, good team, you can provide excellent care. That's been huge.
With our staff that we have, we're able to help elevate them. So we've had, like Dave started with us as a CNA, we were able to elevate him all the way up to a med tech. We've had some med techs that we've elevated up to LPNs. We have some LPNs that we're elevating to RNs. So we're able to put money back into them and help them support the residents and everybody else here.
And how have the residents responded to the changes?
Loving it, loving it.
Okay.
We have a robust activity department, and with the great wealth of knowledge that comes from being part of a team like Ensign, so many new resources have flown into our team. So even though it's the same team, the resource base they have, it's just taken them to a higher level.
So Nick, tell me a little bit more about the therapy that you have here. I see different rooms. So
we offer occupational, physical, and speech. All the therapists and all the assistants are in-house. So they're all part of Timber Ridge. They're all one, so we can have that nice continuity of care. And we do also offer outpatient. So we do have our own little outpatient door where residents are able to come in. So if you were receiving therapy here for your knee, your hip, or whatever, and you go home and you still think you need more therapy, you can come back here, see the same therapist, be in the same areas, so that you have that nice continuity and feel kind of at ease. It just makes it a nice, easy transition for you so that you're able to get back to that higher level functionality and be able to be independent at home longer.
So Marcia, we're here in the chapel. So tell us a little bit about the chapel being open now. What has that done for the community here at Timber Ridge?
Well, thank you, Mike, for asking. The rich history of this chapel has taken us way back to the very early beginning of Portage County. And it's really allowed us as Timber Ridge to continue that culture of really meeting every resident's psychosocial and emotional needs. So by reopening this beautiful chapel, we've been able to meet not only the daily activity needs and the personal care needs, but we've been able to add that spiritual touch that we know is so key to all of us, but particularly our seniors. So it's been very exciting, and maintaining it the way it is has been just an extremely exciting part of our reopening. And we've been gifted to have almost every denomination come in and service us. And what means more to a senior than to be in church with their appropriate minister, priest, whatever, and to really feel as though that lifetime has been continued here. So it's brought a very important spiritual touch to make our care home-like care.
So this has really become really a star in Portage County, correct?
Absolutely. We have been 5-star. I would say we're 5+ star now, because we have not only the services we need, we have the corporate support of a company that can be agile enough and fluid enough in this ever-changing healthcare arena to make decisions when they need to be made. So it's been very refreshing.
Here at Timber Ridge, there's been so many positive changes, and the way the company focuses on it, it is, and you use the term agile, it is key, because healthcare is always changing, always a moving target.
Yes, yes. I mean, you wait a minute and it's different, and particularly since the pandemic, even though we're in endemic, every day is a different day in infection prevention. Now we have the tools to put the immediate practices in place.
So if you have someone that is needing care, you need to come and check out Timber Ridge. It is a facility that has changed dramatically in just a few months.
Correct.
And you are welcome to come here, tour. Nick, Marcia, the staff here is here to help you make a good decision for your loved ones. If you want to learn more about Timber Ridge, Marcia is speaking at our Business Exchange this Wednesday from 7:30 to 8:30 in the morning at the Business Council office, 5501 Vern Holmes Drive. Call the Business Council, register for the Business Exchange. There's no cost to it. It's a free opportunity for you to meet Marcia, hear about life and how we deal with it, and really a chance to learn more about Timber Ridge.